All right, Greg, thank you. I'm chatting here with Dr. Emily Fant. She's an ophthalmologist at Shepherd Eye Center, and she is here this midday. Welcome.
Thank you.
We're talking about glaucoma because it's Glaucoma Awareness Month, the month of January. And will you talk to our viewers a little bit about what glaucoma is? And you mentioned that there's no symptoms.
Yes, most of the time, unfortunately, glaucoma is completely silent until the patient has unfortunately lost an awful lot of eyesight, because by that time they can tell that their eyesight is not right, but by that time the eyesight is almost always permanently lost and there's no way to bring it back.
So many people suffer from glaucoma, and you were telling me, since there's no symptoms, what is something that we can do, since January is Awareness Month? You know, how do we become aware of this problem?
The only way to be aware is to have a comprehensive full eye examination with an ophthalmologist who can look inside the eye, look at the optic nerve, look at the drainage mechanism inside the eye, measure the pressure, and determine whether or not the patient has a risk factor for glaucoma. And then we can oftentimes prevent the problem by treating the patient preventatively if necessary.
How early can you detect that?
You know, it depends tremendously. There are several risk factors for glaucoma, one of which is age over 60, patients who are very nearsighted, patients who are very farsighted, and patients who have a family history of the disease, all of whom are at risk.
So, for example, Dr. Emily, I am very nearsighted. I had LASIK surgery done, but obviously it's something that I should keep an eye on, right?
Yes, because even though you don't need the glasses or contact lenses now, the inside of your eye is still very nearsighted, and so you may still have a risk factor for glaucoma.
You brought us a cool little example here, and I know it's a little bit hard to see on TV, but this is an eye, and you were showing me the inside and telling me a little bit about what you guys do when you're trying to figure out if someone does indeed have glaucoma.
Yes, the inside of the eye, this is the optic nerve here. And that's where the fibers are damaged when glaucoma occurs. The other problem is that there's a drainage mechanism in the front of the eye, and we think in most cases that the drainage mechanism fails to perform adequately as life goes on. So we think pressure builds up in the eye in some patients, not all, and that causes the damage to the optic nerve.
Okay.
Unfortunately, you can't see that drain unless you look at the eye in a very specific manner. So it requires a full eye examination to do that.
Why it's so important to go ahead and see your doctor. A lot of very well-known people like Bono have glaucoma. That's why he wears the glasses, right?
You know, I think he wears the glasses because he's light sensitive.
Okay.
But unfortunately, glasses don't fix glaucoma either.
So again, January Glaucoma Awareness Month, so you'll want to, especially if you're over 60, go ahead and make sure that you see an ophthalmologist.
That's correct.
Dr. Emily, nice to meet you.
Thank you very much.
Thank you for being here on Midday with us. We're going to put some more information on the Shepherd Eye Center and how you can get an appointment on ktnv.com. We're not done yet.